nerve goes out, you lose the lateral rectus, and the eye has a tendency to turn in. So a sixth nerve palsy causes a crossed eye. And so that's what it looks like, a crossed eye. These are pretty easy to diagnose. They got a crossed eye, and the eye doesn't want to move out. And what are the causes? Once again, vasculopathic. Start thinking about diabetes, hypertension. You also think about tumor. But the special one that I want to emphasize with these sixth nerve palsies is you can also see this with high intracranial pressure. Something about high pressure inside the skull causes problems with that sixth nerve. And you can think of the brain sitting inside the skull. It's sitting in CSF, cerebrospinal fluid. And that fluid's very similar to aqueous in the front of the eye. In fact, they have almost the same content. And the medications we use to lower pressure, like Diamox, they work for the brain as well. But high pressure. And we think that something about the funny turn that the sixth nerve makes as it pops up and then makes a sharp 90-degree angle going through the cavernous sinus directly into the back of the eye socket. Something about that maybe makes it predisposed to high. Looking at our eyes, we see the following. Pretty obvious here. The eyes look crossed. But what's the problem? Which eye is it? Could it be both eyes? Could this be a bilateral sixth nerve palsy? Perhaps. That's sort of what this looks like. Neither eye can abduct outwards, which looks like sixth nerve palsy. So, what's on our differential? We have a 29-year-old woman, headaches, recent antibiotic use, sixth nerve palsy in both eyes. Once again, we go through our differential. Vasculopathic, she's young, doesn't have diabetes, doesn't have high blood pressure. Tumor, maybe pretty young to have a tumor. But could this be increased intracranial pressure, high pressure in the brain causing her headaches? Perhaps. Looking in the back of her eye, we look at her optic nerves, and they look somewhat full and swollen to us. Obviously, you're not seeing this in 3D, but this is kind of pouching outwards. Both eyes, papilledema, we pretty much have clinched our diagnosis of pseudotumor cerebri, and certain things seem to set that condition off, including antibiotic use. Looking at his eyes under the microscope, we see the following. Primary, okay, but something going on with his right eye. It doesn't look like it's going out as well as it should. So perhaps this is a right nerve sixth palsy. So here we go. We have an 82-year-old gentleman, high blood pressure, general malaise, not feeling great, with a sixth nerve palsy. What's on our differential? As always, we go through our list. Vasculopathic, diabetes, high blood pressure. He's got high blood pressure. Okay, well, that could be it. Tumor, maybe. It happens. Cranial pressure, he's not really complaining of neck stiffness or chronic headaches, but maybe. But here's the issue. This is a 82-year-old gentleman who's having malaise and maybe some scalp tenderness. You always have to think about things like temporal arteritis. Any person you have who has a new neurologic finding, either with the eyeball or the eyeball muscles, who is over, say, 60, 65, consider temporal arteritis. When you look for the classic symptoms, jaw claudication, scalp tenderness, sixth nerve, controls only one muscle, the lateral rectus, and when it goes out, you get a crossed eye. And one of the potential causes, especially with bilateral sixth nerves, is high intracranial pressure.